Hi, my name is Mia Bennion, and today I will be talking to you about my PhD project titled Enhancing Engagement with Between Session Work in Low Intensity CBT-Based Interventions, supervised by Professor Penny B, Professor Karina Lovell, and Dr. Amy Blakemore. When engaging with a psychological therapy to treat a mental health difficulty, it's neither new nor uncommon for clients to complete therapeutic work outside of treatment sessions. Since its establishment, between-session work has been particularly endorsed in cognitive behavioural therapy and remains a core feature of the approach. The underlying theory behind CBT states that difficulties can be managed by identifying and changing any disruptive thoughts or behaviours. Between-session work acts as the vehicle to do this, translating the contents of treatment sessions into everyday life. Nationally implemented in 2008, the Improving Access to Psychological Therapy scheme, otherwise known as IAPT, aims to increase UK public access to evidence-based psychological treatments. Usually offered to IAPT clients first, low-intensity CBT-based interventions involve less time spent with a practitioner in treatment sessions compared to traditional high-intensity CBT, typically around 4 to 6 hours, meaning independent engagement with between-session work is particularly essential. Prior to commencing my PhD, I worked in an NHS IAPT service delivering low-intensity interventions, and one of the first things I outlined to clients before beginning treatment was that most of the therapeutic work taking place will actually occur outside of sessions. Previous research into the topic has mainly explored the effect of between-session work on treatment outcomes. Several meta-analyses have shown robust evidence in favour of between-session work for both correlational and causal effects. However, engagement with between-session work appears to vary across studies, with non-adherence with between-session work repeatedly noted as a common occurrence in CBT. Authors began to encourage research efforts should shift to exploring wider factors within the topic, such as what factors determines a client engagement with between-session work in CBT. Individual studies have sought to explore this, yet potentially due to a number of differing methodological designs and small sample sizes, findings have been conflicting and inconclusive. In 2019 to 2020, over 1.1 million people accessed treatments in IAPT services, many of which will have engaged with a low-intensity intervention and thus between-session work. This means that understanding the factors which affect engagement with between-session work in low-intensity interventions is essential, given that previous research has shown that between-session work enhances treatment outcomes. The overall aim of the PhD project is to identify the factors which affect client engagement in low-intensity CBT-based interventions and how and why these have an impact. The PhD project seeks to do this in 2 phases. The first phase consists of a systematic review identifying the predictors of engagement with between-session work across CBT-based interventions. The review employs a best fit framework synthesis, which involves systematically searching the literature for an already existing conceptual model, developed for a potentially different but still relevant health behavioural population. The model or models is then reduced into an a priori framework in which the primary studies retrieved in the systematic searches are mapped onto. The final product of the synthesis is a conceptual model of engagement between session work across CBT-based interventions. Following this, the second phase of the study involves a qualitative study in which the overall aim is to interrogate and augment the model developed in phase 1. I plan to interview both low-intensity IAPT patients and professionals in order to gather their perspectives on what they feel affects engagement with between-session work in low-intensity and CBT-based interventions. In a view to improve the quality and relevance of the research, I plan to work with public and patient contributors throughout wherever possible in the study, possibly through linking with the NIHR, ARC, GM, PCIE panel and forum if possible. Currently, we are finalising the specific details of the qualitative study with a view to submit the HRA NHS Rec Ethics application in late November to December, and are currently in the final stages of title and abstract screening in the systematic review. Thank you for listening today.